Good evening, Madam President. I rise on this bill not so much to talk about whether or not we need to look at management of skilled nursing facilities and healthcare outcomes, but just on, I think it's important that, to be honest on this subject, we recognize that it wasn't the ownership of skilled nursing facilities during the pandemic that exacerbated the number of COVID-related deaths in Connecticut. And we can't allow well, let me just back up. The state engaged the Mathematica report, which basically was an indictment on the state of Connecticut for what transpired during the early days of the pandemic that helped exacerbate the number of deaths in our skilled nursing facilities and put seniors at risk. The Mathematica report came back with 45 recommendations, 45. And in looking through those 45 recommendations to make sure that this doesn't repeat itself, I don't recall seeing one that talked about ownership of skilled nursing facilities. No. Instead, it talked about very practical issues that were not prevalent at the time. Just to take you back a little walk through memory lane, back in the early days of the pandemic, all people working for the state of Connecticut were sent home. They were sent home to work remotely for good reason. But what was forgotten were the daily reports from the skilled nursing homes were sent to DPH via fax. And nobody at DPH thought it was wise to send somebody in on a daily basis to pick up the fax, to see the reports, and to see whether or not lives were at risk. Practical, common sense solution, void at the time. Also at the time, the state's emergency management positions were vacant. Were vacant at the time. Other issues, reimbursement of costs. Nursing facilities in Connecticut are underfunded by our state government. We have one of the lowest in the country. We're a state of our prosperity and wealth ranks, I think, 46th in Medicaid reimbursement to our facilities. 46th. And yet you're going to ask these facilities to purchase PPE and other I'm just going to say materials and control so that you can basically control the infection. That's real. It doesn't have to do with their management, because this happened to skilled nursing facilities that were private equity as well as family owned, because it's about the state of Connecticut and what we did and didn't do. We need to study that. There was no stockpile of PPE, and then when we had to purchase it, they didn't have the resources or the funds. Why? Because once again, the artificially low reimbursement rate. The care transitions that were going on at the time. Transitions from hospitals to nursing homes, and the failure to make sure that we were containing the infection, as well as not testing staff that were coming in and out. And dare I talk about the social isolation of so many seniors being separated from their families. Believe me, this is the last thing I wanted to be thinking about this evening, was taking not only a walk down memory lane back to the beginning days of COVID, but as an elder law attorney dealing with the clients I had sitting in nursing homes that were petrified that they were going to die because their roommate was just discharged and admitted to the nursing home facility. They had COVID, and up until that point, they didn't. and the facility was saying, no, don't open that window, and you can't open your door, and you're stuck there. These were the calls I was getting both from residents and from families. We need to look at the Mathematica report. We need to not allow things like this to ever happen again. But I don't want to sit here and say everything that happened during COVID was because of management of a skilled nursing facility, because it wasn't. Quite frankly, to a large part, it had nothing to do with it. So if we want to talk about this bill and we want to look at the issue of ownership and whether or not it helps increase health outcomes, yes, that's an honest question. That's an honest discussion. Let's have that one. But let's not mistake and place the blame on ownership when the state of Connecticut had a measure of blame in what happened during COVID. And I think if you talk to any of the families that lost a loved one, any of the families that had to go through the social isolation and separation of not being able to see their loved ones, I think they'd agree with what I'm saying. So, Madam President, we can proceed with this bill and study the issue that's before us with regards to ownership and health outcomes. I think that's a worthy endeavor and looking at it. But I don't want for 1 second to believe that ownership either was a sole reason, but it wasn't even one of the 45 recommendations of the Mathematica report that studied this specific issue. We owe it to the families and to the people who perished to get this right so that it never happens again. But in order to do that, we have to make sure we're looking at the right issue. So thank you, Madam President, for allowing me to speak and to make this point, because I think it's an important one that we must never forget. Thank you.
Thank you, Senator Kelly. Will you remark further?